Did you know that chiropractic care can work really well at helping you alleviate knee pain? That's right, knee pain. Well, how is that? Well, the first thing we need to do is get an accurate diagnosis. Is your knee pain being referred from the hip? In fact, 50% of knee pain comes from hip problems. Or could it be a foot problem where your foot's rotated out or flattened, creating knee pain? So let's get an accurate diagnosis. Once we get an accurate diagnosis and we confirm there is a dysfunction in the knee, well, where is the dysfunction coming from? Is it coming from a joint problem? Well, you have a bone on the outside of your lower leg and one on the inside. You have two bones there. You have your femur, your thigh bone coming down, and you have your kneecap. Are they all moving properly and with normal mechanics? If they aren't, you may need chiropractic adjustments to get those things moving better. A real common problem with knee pain is the kneecap itself just isn't tracking properly, meaning it doesn't stay in its groove. It generally has a tendency to drift out, and that'll create knee pain. How do we resolve that? Well, we need to get all these tight muscles on the outside to relax and strengthen up the muscles on the inside. However, if there's a knee tracking problem, patellofemoral tracking it's called, a lot of times we have to look at the hip also, because the hip muscles are strong enough to keep your femur, your thigh bone, in alignment. If your femur starts to drift in, then the knee bone is going to drift out. The way to keep the femur, the thigh bone, from drifting in is to keep these hip muscles really strong. So even though we know the inflammation and pain may be coming from the knee, and we know that the patella, the kneecap, may not be tracking properly, the solution isn't always as simple as, well, just get that to track properly by strengthening the muscles on the inside of the knee. That's one component. You have to look at the hip and you have to look at the foot. Think about it. The knee doesn't have a lot of muscles around it. They all support up to it. It's not like the hip where everything's very deep. So what happens in the foot and happens in the knee, in the hip, impacts the knee. So what do? If we know there's abnormal tracking of the kneecap, we need to strengthen these muscles, done with terminal knee extensions, which is just going the last 30 degrees of extension. They can be done with a weight or without a weight to activate this muscle here, your vasti medialis. The next thing we need to do is make sure we've released any tension, any tightness in the outside of the leg, which would pull the kneecap out. All right? We would use a procedure called Graston, or active release, for that. Graston is where we take stainless steel tools and we work on the skin to release tightness. Active release is where I take my hands and I get in there and I release tightness. Tightness on the outside causes that kneecap to drift. Once we've released the tightness, and we've talked about some strengthening not only of here but also of the hip, and we've made sure the foot's a nice balanced support, how do we keep our athletes active and playing with having the kneecap not tracking properly? And how do we help our everyday people get through their everyday activities without knee pain? Kinesio tape. And the first tape we want to place is over this inside muscle, and bend the knee. And if you notice it, I'm pasting it to the inside and wrapping it around the kneecap so that it slowly and gently pulls the kneecap to the inside, because the kneecap wants to go to the outside. Then we take another piece of Kinesio tape and we want to keep that kneecap tracking in the middle. So this happens to be black. The reason I'm using black so you can see it a little bit better, because they are two different muscles that we're taping. The vasti medialis, now we're doing the quad and quadriceps with the vasti intermedialis. Bend the knee, please. And this goes right over the center of the knee to help that kneecap track up. So we have a VMO taping to pull the kneecap in, quadriceps taping to help pull the kneecap straight up. You notice I'm not doing anything to pull it this way. Very effective to keep people out of pain while this is healing. Responds very well. Oftentimes we'll also add other modalities: ice, electrical stimulation, ultrasound, cold laser, to keep the swelling and inflammation down. But what you need to understand is that knee pain responds extremely well to the biomechanical and natural approach of chiropractic, where we look at the whole lower extremity, the ankle, the foot, the knee, the hip, the spine, make sure it's all balanced. Then we strengthen up weak areas, we stretch, release tight areas, we support areas of inflammation, and the net result is you don't have knee pain anymore. So now you know knee pain, abnormal patellar tracking responds extremely well to chiropractic care.